Have you ever struggled to get through the night without waking up again and again just to use the bathroom? Maybe it happens 2, 3, or even 4 times before morning comes. At first, you might laugh it off, thinking it's just because you drank too much water before bed. But when it becomes a pattern, it begins to steal your rest, leave you exhausted, and affect your focus and energy the next day. This problem called nocturia is surprisingly common, especially as we get older. But here's what many people don't realize. It's not just about sleep. Frequent urination at night can be your body's way of warning you about underlying conditions such as diabetes, prostate enlargement, kidney disease, or even heart problems. In today's video, we'll uncover why nocturia happens and show you how a urologist can help you find answers, relief, and better sleep. Frequent urination at night, also known as nocturia, might seem like just a small annoyance, but it can have a major impact on health and quality of life. When your sleep is interrupted 2 or 3 times every night, your body never gets the deep, restorative rest it needs. Over time, this can leave you feeling constantly tired, irritable, and unable to concentrate during the day. Poor sleep also weakens your immune system, increases your risk of heart disease, and affects memory and mood. But nocturia is not only about sleep disruption. It can also be an important early warning sign of underlying medical conditions. For example, diabetes often reveals itself through frequent nighttime urination, as the body tries to flush out excess sugar through urine. Men may experience nocturia due to prostate enlargement, which blocks normal urine flow and leaves the bladder feeling full. Women might notice it after menopause, when hormonal changes affect bladder function. In both men and women, kidney disease, bladder infections, or even heart conditions that cause fluid buildup can all lead to waking up multiple times at night. The truth is, nocturia should never be dismissed as just getting older. While age can play a role, frequent urination at night is your body's way of saying something more is happening. Identifying the cause early can prevent complications, protect your organs, and restore the sleep your body depends on. When nocturia becomes a frequent problem, one of the best steps you can take is to see a urologist. A urologist is a doctor who specializes in the urinary system, the kidneys, bladder, and urethra, and for men, the prostate and reproductive organs. Unlike a general doctor, a urologist has deeper training, more advanced tools, and years of experience focused on these specific conditions. During your appointment, the urologist will begin by taking a thorough medical history. They'll ask when the nighttime urination started, how many times you typically wake up, and whether you also experience urgency, weak flow, or pain. They'll review your medications, diet, and fluid intake, since certain drugs or habits, like drinking caffeine or alcohol in the evening, can worsen nocturia. Next, the urologist may perform a physical exam, checking the abdomen for bladder or kidney issues, and in men, assessing the prostate gland for enlargement. Women may be evaluated for pelvic floor changes that can affect bladder control. But what sets a urologist apart is the ability to order specialized tests, urine analysis, blood sugar and kidney function tests, bladder ultrasounds, and sometimes cystoscopy. These tests allow them to see beyond the surface and uncover hidden causes that basic exams can miss. By the end of the visit, you'll not only understand what's driving your frequent urination, but also have a personalized plan for managing it. That combination of expertise and focused care is why a urologist is often the key to solving nocturia. When you see a urologist for frequent nighttime urination, their main goal is to identify the exact cause. While some reasons are simple, others can be much more complex, and only a urologist has the tools to uncover them. One of the most common causes in men is benign prostatic hyperplasia, BPH, or prostate enlargement. As the prostate grows, it squeezes the urethra and prevents the bladder from emptying completely. This makes men wake up multiple times each night with the urge to urinate. Another frequent cause is an overactive bladder. In this condition, the bladder muscles contract too often or too strongly, creating sudden urges even when the bladder isn't full. Both men and women can experience this, and it often worsens at night. Diabetes is another culprit. High blood sugar draws extra fluid into the urine, leading to frequent urination. Many people first learn they have diabetes after seeing a urologist for nocturia. More serious but less common causes include kidney or bladder stones, which irritate the urinary tract, and bladder cancer, which can present with symptoms like frequency, urgency, or blood in the urine. Urologists are trained to look for these red flags early when treatment is most effective. Heart conditions can also play a role. Fluid may build up in the legs during the day and shift back into circulation when you lie down at night, forcing the kidneys to produce more urine. By systematically ruling out these possibilities, a urologist can pinpoint the true cause of your nocturia and tailor treatment to your unique situation. That precision is what makes their role so essential. Once the urologist identifies the cause of nocturia, the next step is designing a treatment plan. The good news is that in most cases, both medical therapy and simple lifestyle adjustments can make a big difference. If an infection is to blame, a course of antibiotics may solve the problem quickly. For men with prostate enlargement, BPH, medications that relax the muscles around the prostate or shrink its size are often prescribed. In more advanced cases, minimally invasive procedures can restore normal urine flow. For overactive bladder, urologists may recommend bladder training exercises, medications that calm bladder contractions, or even nerve stimulation therapies if symptoms are severe. When diabetes is the underlying cause, controlling blood sugar through diet, exercise, and medication is essential. This not only reduces nighttime urination, but also protects long-term health. If heart disease or kidney problems contribute, the urologist may coordinate care with cardiologists or nephrologists for a comprehensive approach. Lifestyle changes are equally important. Reducing caffeine and alcohol, especially in the evening, can ease bladder irritation. Limiting fluids 2 to 3 hours before bedtime helps reduce nighttime trips. Elevating your legs in the late afternoon can shift fluid earlier in the day, reducing the amount processed at night. Strengthening the pelvic floor with Kegel exercises also improves bladder control. The most empowering part is that these solutions are highly personalized. By combining medical treatment with targeted lifestyle adjustments, most patients experience fewer nighttime interruptions, deeper sleep, and improved quality of life. Frequent urination at night may seem like just an inconvenience, but it's often your body's way of asking for help. Whether it's prostate enlargement, an overactive bladder, diabetes, or something more serious. The good news is that a urologist has the expertise to uncover the cause and guide you toward the right solution. The impact of better sleep goes beyond rest. When you treat nocturia, you regain your energy, focus, mood, and confidence. Life feels easier when you're not waking up every hour to find the bathroom. So don't ignore the signs. If nighttime urination is disturbing your sleep or worrying you, take the step, make an appointment with a urologist, ask the important questions, and take control of your health. If you found this video helpful, please like, share it with a friend, and subscribe for more health insights designed to protect your well-being.